Hello, you're welcome to my channel. My name is Adora, and if you are new to this channel, thank you very much for stopping by. Please kindly press the subscribe button so that from time to time you will be notified if we have any topic of interest to you. Thank you. Now, being a carer can be very rewarding and fulfilling in the sense that you are making a difference and you're touching lives positively. But at the same time, it's also a very stressful job due to the emotional and physical demands associated with the stress, which can often lead to fatigue and burnout. Oftentimes, some carers feel unwell and uncomfortable during the course of their job, but they do not really know exactly where that feeling is coming from. So as a carer, it's very important to identify certain feelings you are having so that you can be able to know if you're going through the carer fatigue and burnout. Now, the first sign is feeling very tired and lethargic even after sleeping. Now, in some cases, you come back from your shift, you go to sleep, and when you wake up, you discover that you still feel very tired and you still feel like going back to bed. You still feel very weak. You still feel like you've not had enough rest. That's because the body might have been overworked and you have not had enough sleep. So the amount of sleep you've had might not be enough to cover up the amount of work the body has actually performed. Well, that's why in most cases you find yourself still feeling very tired, even when you have slept, you still see yourself feeling very weak. You just think you need to go back to sleep. Now, it's not just about sleeping, but the quality of sleep you have had. The amount of time you have spent sleeping is another thing that also adds up to know if you have really done your body good or not. Also, you become more irritable, short-tempered, and impatient. And this is also as a result of stress that must have accumulated during the course of your shift or during the course of your work. Now, at this point, when you feel this way, it's always very, very good that you take a break so that you can come out of this feeling you have, because this, at some point, if care is not taken, could actually lead you to depression. Next, you begin to lose interest in things you used to enjoy. If you love going out before, if you love making friends, if you love a particular hobby, if you love a particular craft, you find out that you begin to lose interest in these things. It's not as if these things were never the things you used to like, but at some point, due to the stress of the job, due to the stress of what you see from time to time, due to the stress of how much time you have put in the job and it's all weighing or telling on you, you start losing interest in every other thing that has to do with your life. You are really overwhelmed by the work and by everything that has to do with it. This is another sign that you are burnt out and you need some time off. Which now brings us to the point of actually feeling anxious and depressed. Now, this point is a point most carers actually find themselves. A lot of carers find themselves at this point where they are feeling very anxious and depressed. And it's not because it's their nature to be depressed, or it's not because they just feel like falling into this line. But like I've said, stress could lead to a lot of things. When you are being overworked, when you are being so stressed out, when you're being overwhelmed with what you are doing at the moment, it could actually lead you to the point where you feel very confused, irritated, and depressed. The next sign is that you start neglecting yourself. You start neglecting your personal and your emotional needs. Now, this is not really normal because this is something maybe you used to enjoy doing before, but at some point you start seeing yourself thinking it's all about work, 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 work. You're really stressed away with the work. You're carried away with the work. And then other things aside of your work begins to suffer. So at this point, you now need to balance things up to make yourself happy and to avoid depression at the end of the day. Now, the next sign is sleep disturbance and change in sleep patterns. Now, this is very, very common among people who work the night shift. When you go work the night shift, you discover that in most cases, the rest of the day is almost useless as you use the whole day to sleep. You are not really being productive in all the aspects because you definitely need to rest your body. You definitely need to cover up for the period of time you've been awake doing your shift. So you find out that in most cases, while people are working out there, people are being productive, people are socializing and all that, you are using the bulk of that time to sleep in the daytime because you have worked all night. You have worked all night, which kind of isolates you from what the rest of the world is doing during the day. Also, some carers can now be a victim of drug or alcohol abuse unintentionally, in the sense that now, because the job is quite a demanding one, they could be physically stressed out, they could be mentally stressed out. So they need, or rather they think they need, to be able to calm themselves and relieve themselves of the stress. So most times you see some carers really binging on self-medicated painkillers to reduce the body ache they are having. And sometimes some people also find succor in alcohol to take their mind off the stress they have gone through, or to relieve them of their anxiety and depression that they are actually going through at the moment. So by so doing, they fall a victim of drug and alcohol abuse without even being aware of it. Last but not the least, due to the stress, the mental stress, the physical stress, the psychological stress, and all of that you have to deal with, you begin to feel quite irritated. You begin to feel really very impatient. You begin to feel very intolerant. And before you know it, you might start to transfer your frustration on others. And if you are not careful, you might even start to transfer your frustration on the people you are supposed to be looking after. That's the one reason why you should be able to detect these signs of a carer burnout when you think your body is actually telling you something. You should be able to hold on to something. You should be able to monitor how your body changes, how your life changes, how your health changes, so that you can do something about it as soon as possible. Thank you very much for watching. In my next video, I'll be giving you tips on how to deal with burnout and how to take care of your health as a caregiver, so that you will be able to carry out your duty more effectively and enjoy your duty as it is meant to be. Thank you very much for watching, and stay tuned. Hello, you welcome to my channel. My name is Adora. Today I'll be giving you tips on how to take care of your mental health and how to avoid burnout as a carer.